everyone. Thanks for coming out today. Let's get this started. Hello, and good morning. My name is Hilton, and I'm running to represent District 112 in the South Carolina State House. I'm running because this is my home, where I've grown up and where I've had my values instilled in me. My neighbors have always been there for me. Now, I feel called to be there for them, to represent our low country and the communities we hold dear. When I was born with a brain tumor, astrocytoma to be specific. When I was 7, it grew so large that doctors were shocked I had not already suffocated in my sleep. When they found the tumor on my MRI, I was immediately rushed to the hospital. There was no time for family to research, no time to ask questions. The hospital I ended up in was in our state's capital, Columbia, South Carolina. South Carolina saved my life. I'm alive today because of this state, because of the hard-working men and women that call this state home. Now, it is my turn to give back. As a current student, I want to improve the education system for my fellow classmates and those who will come after me. I want to lay a strong foundation for our state's youth to spring off of. I want to reform the criminal justice system so that the society I'm a part of enshrines the values of liberty and justice for all. I want to create a 21st century economy that works for all because a healthier society benefits everyone. We are only as strong as our weakest link. While I am young, my youth provides me with a unique perspective, a perspective that will bring the Low Country to the forefront of South Carolina dialogue in the State House. By virtue of my position, I have the ability to connect with the teens and young adults who feel misrepresented, as well as connect with grown and experienced adults who want to see change. Together, we can shake things up. We can create justice and prosperity together. Look out for our neighbors and fellow statesmen together. To strengthen our community, we must support our small businesses and bolster the safety net for those who take on the risk. The COVID-19 pandemic shuttered many of these valuable businesses, leaving their employees and owners with nothing left. Many of these workers are wary to venture back after seeing the horrific response of our government. Many of these workers, while starting a new small business will come with risk, we need to ensure everyone that starting one, there will be risk, but if luck turns against you, you will not lose everything. South Carolina also needs to do more to encourage this creation of small businesses in low-income areas, which will stir even more economic activity. Job creation throughout the state can also bolster our local communities by connecting them together with a modern transportation system, one which will guarantee that positive economic activity in one community will spread everywhere. Along with bolstering our economic activity and strength, we must also bolster the strength of our medical systems. We need to ensure that everyone has access to quality healthcare without destroying their personal finances. We need to ensure that we live in a healthier community because it goes hand in hand with our economy. A healthier community is a more prosperous community. Ultimately, we need a Medicare for All system that can guarantee this access to propel us into an economically prosperous and humanly healthy future. No one should feel invisible in our system. Everyone should feel that we care for them and their families because we do. My family has top-of-the-line private insurance. Even with that, my 1.5-mile ambulance ride and 5-minute hospital stay costs over $1,000 out of pocket. This is a cost that the majority of families would not be able to bear with advance warning, much less in an emergency. In the United States, the average person spends over $11,000 on health insurance, immensely more than any other wealthy nation. Our private insurance costs, our co-payment costs, our medicine costs, all the money we pour into our healthcare is not only exorbitantly high, but also pointless. There's no necessary reason for the wealthiest nation in the world to exploit its citizens in this matter. In fact, the only reason is because insurance companies have taken advantage of our system and rigged it against our citizens, artificially raising prices that they know will be paid because people want to live. The South Carolinian people will not stand for this medical extortion any longer. We will stand up and flip the system on its head, giving the power to the people. By instituting this system, we will be able to implement mass bargaining power, cut administration costs, and eliminate co-payments along with other needless expenses. This not only makes Medicare for All the decision that looks out for our health of our community, but also our wallets. In South Carolina, we need to expand advocacy for the system and expand current healthcare solutions that are available to us. We have the ability as a state to set a call for action for the rest of the country to act. This healthcare system will not only lead to a healthier society by providing access to everyone, but increase the volume of preemptive care. People will no longer be worried about the co-payments and other expenses that they would incur under our current system. Instead of worrying about paying high costs for no results, individuals will be more inclined to seek medical advice and are concerned about their health. This will lead to many more diseases being caught early, and treatment is not only cheaper, but more likely to succeed These changes are necessary to preserve the lives of our citizens. This preemptive care is what everyone wants. No one wants to be stressed over financials when they're worried about possibly having cancer. No one should have to hold off on their medical care because the paycheck has yet to come in. This bolstered healthcare system will provide uniformity and stronger trust in our doctor's offices because we will know that someone is looking out for our best interest. Through collective bargaining on medicine costs and ensuring preemptive care, our healthcare can continue to be maintained. This will reduce the per capita cost of our healthcare and allow our money to go towards development and human capital. Along with developing and reforming our current healthcare system, we must also reform our education system to accurately reflect the world around us and the one that our students will be entering. We need to consider transferring into an intra-year schooling system, teaching our students about personal finance, increasing trade school attendance, tuition-free colleges, and paying our teachers appropriately, as well as teaching our students proper sex education. In South Carolina, our teen pregnancy rate is 22%, one of the highest in the nation. This is directly due to a lack of access to birth control and inadequate education. Teens are going to participate in sexual activities. This is guaranteed. Knowing this, we must adapt our education around this fact. Currently, in South Carolina, our education system places emphasis on abstinence-only education for an incredibly short period of time. The solution to our teen pregnancy rate and future intimacy issues that our students may face is to implement the two-pronged approach of proper education in both content and duration. We need to put an emphasis on contraceptive methods that our youth understand how to avoid unwanted pregnancy. We need to teach about non-heterosexual health so that no student is left out of the conversation and left clueless by their education. Everyone deserves to be seen in what we teach. The curriculum should also touch on practices unrelated to reproduction to mitigate stigma surrounding sex in our community. These topics should not be dumped all on students in one semester and never talked about again. Instead, our education system needs to reflect the growing nature of human biology and teach health throughout our education, getting deeper into the topic each time. Our community's children deserve not to be left in the dark and deserve to be armed with the information to stay safe and healthy as they advance into adulthood. Another important tool that we must give our children is that of financial education in our public schools. Today, in South Carolina, thousands of people graduate high school every year, never having been taught how to grow their wealth over time, how to budget, nor how to save for an emergency. Personal finances touch every aspect of our lives, and not having a financial education can be devastating on them. Nearly half of our fellow South Carolinians would not be able to afford a $400 emergency. Young adults hold over $1.5 trillion in debt. Over a third of people hold credit card debt worth over $15,000 each, and a third of people have $0 saved for retirement. All these issues can be tackled through proper financial education in our public schools, where debt and wealth creation are taught in a manner that will set our community's children on the right path. A path that not only sets them up for a successful future, but also one that does not include a punitive criminal justice system, one which would derail them for petty things such as marijuana usage. South Carolina needs to not only legalize medical marijuana, which can be used to treat many ailments, but also recreational marijuana, as well as expunging the records of those convicted for its use. This will not only lead to more economic activity in this new sector, but will also give second chances to those who have been wrongfully imprisoned. Because aren't second chances what we as a people are about? But above and beyond the economic advantage of legalizing recreational marijuana, there's also the moral advantage of legalizing a substance that never should have been banned in the first place. While we're at it, why don't we decriminalize all drugs? Hear me out. Let me explain. They're only illegal because the thought is that people will be too scared to use them. But in reality, it makes people too scared to ask for help. And it puts these drugs on the black market where variants of hard drugs are created, which pose health risks that doctors are unable to fight because they don't know what the risks are. What if instead of throwing everyone who is caught slipping into addiction into jail, we unburden the police and prisons and decriminalize its use? By decriminalizing use, it would mean that if caught, you would have the option of paying a fine or going to rehab. This way, people with an addiction will be more likely to reach out for help instead of fearing it. We see in other places where this has been done that drug use and death drops. So why should South Carolina not follow these facts to the logical conclusion and decriminalize? This is what I want to see for South Carolina: fact-based decisions. We are each other's neighbors. No matter what, we look out for one another. We all want the best for our community, and if there was anything we could do to make it better, we would. We all want the children in our community to succeed. We all want a thriving economy fueled by small businesses that keep our finances healthy. We all want what is best, and I believe that I can help bring about what is best. Please join me at the primary and at the general to cast your vote for the future. Your vote is the most powerful thing you can own. Together, we move forward. Together, united, indivisible, with liberty, and justice for all. Bless District 112, bless South Carolina, bless you, and I look forward to earning your vote at the primary and the general. Thank you.